Hi doctor,
Hi,
how's it going?
I'm fine, thank you.
So
Tell-
how was the day so far?
Yeah, it's fine. So today we'll discuss about knee pain.
Yeah.
Yeah,
So there are some questions that I've gathered for you because the general crowd that's not medical professionals, they have some questions that they don't have an answer for, and you know that when we Google things on about our pain and our symptoms, the answers are never correct.
yeah. There are so many answers are there, and so
Ethicism.
one has to have that type of knowledge to assimilate that for that particular patient.
Makes sense.
This
So there's
is
a joke going on that no matter what symptoms you put on Google, it comes up as cancer only. Yeah, so they always give the worst option available.
yeah. Whatever the options are there,
Hmm.
and those the most targeted, most searched options, Google will give that only. No,
Absolutely.
Google doesn't have.
Yeah.
Because most of the people they are afraid of this cancer. That's why they ask the question,
Hmm.
and Google also gives that type of answers.
Makes sense. I feel like ChatGPT is better than Google when it comes to putting symptoms and asking what.
Yeah.
It's much more refined and gives
Little
proper
bit.
answers. Yeah.
But you should know what are the questions to be asked. The knee pain, what exactly it is? It may come from the joint or from the outside of the joint, and depends on the patient to patient, depend the age group, depend on the signs and symptoms. So we have to understand whether that pain is coming from the knee joint itself or the muscles, tendons and the ligaments which are attached to that particular joint. They are called, as in our medical term, we call it periarticular pain and intra-articular pain. What exactly intra-articular pain? This is the knee joint. This is your femur. This is the upper side. This is thigh bone. These are the leg bone. The leg, two bones are there. Here this joint. This is the moment, and there is a patella. What is called as a vati बोलते हैं, जो वाटी बोलते हैं उसको. This is patella, and this is a mobile joint. Okay, and the pain may be due to the issue inside the joint from the bones, cartilage, or the muscles which are attached from outside, and which is then ligaments, tendons, all those things.
Okay.
So that is divided into intra-articular and extra-articular. Extra-articular is outside the joint. So if the major part of your pain is from the intra-articular, from the joint, then surgery will help.
Okay.
If it is major part is from outside and minor part is this joint, and you have done the surgery, that means you have not addressed the muscular component of the pain.
So the
major problem you have not addressed. Then patient, after surgery also patient gets pain.
Okay.
That is the cause what you are asked. No.
Okay.
That is the cause why the patients get pain after surgery also.
So what I'm to understand is that if the primary cause of their pain is the exterior part, instead of going for the surgery, they should first fix that.
Yeah. Nowadays this is a recommendation. You have to do non-invasive procedures, non-invasive treatments for the any type of pain first. If that doesn't give you good relief, or that is your activities are not optimized, and your lifestyle is hampered because of that pain, then you can take the option of the intervention, like interventional procedures or intervention, that is surgery. Interventional procedures are done by the pain physicians, interventional pain physicians, and other part, musculoskeletal part, also looked after by the pain physicians, and the exercise part is looked after by the physiotherapists.
Okay. Makes sense. And when it comes to knee surgery, this is very common thing we have heard ki, cartilage depletion. I understand it partially, but for cartilage depletion, is surgery really required? or is there something that we can do so the body can heal itself?
Yeah, there are some techniques and there are some procedures where the body can heal itself and regeneration of the cartilage occurs. What exactly the pathology? Here the joint, the part which is at which come across to the other tibia, this part of the bone, they have the small cartilage part, that is the covering of the bone. Okay, that cartilage secretes some fluid, that is the reason we are getting some fluid inside, and that cartilage, they give the buffer, and after in between these cartilages there are some meniscus, there are some buffer. They are the menisci. Okay, the plural is menisci. Meniscus is single one, menisci is plural one. So there are menisci. They act as a buffer at the time of walking, running, all these things. Everything is bathed with the synovial fluid. That synovial fluid means there is a lubricant fluid.
Okay.
That lubricant fluid is secreted from the cartilage. If the cartilage degenerates, then the fluid regeneration is less.
Okay.
Then what happens? These bones, they come together, and this menisci, they get torn. Okay.
Oh.
Then these two bones, they come.
They grind against each other.
They grind against each other, and there will be a friction.
Okay.
Then there will be inflammation. Once there is inflammation, then what happens? There is some more fluid generation occurs. Then knee effusion occurs. So patient come with a swelling of the knee, and most of the time once you remove that fluid, again it forms. All these things occurs. So the way you asked the question, the regeneration can occur. Yes, we can give the regenerative. There are so many regenerative methods. One of them is your platelet-rich plasma. This is very common. They use platelet-rich plasma, the autologous platelet-rich plasma. What exactly autologous platelet-rich plasma? That means patient's blood we take, and freshly prepared autologous plasma, platelet-rich plasma, we put inside the joint.
Okay.
That is one type of regeneration method. And other we take your fat cells. Then from fat cells we take the growth factors and put inside. That is one is there. Or else we take your bone marrow. From there we take some growth factors and put inside the joint. There's so many procedures are there.
Depends upon the
Depends
condition.
Depends on the condition. Depends on the doctor's expertise. Depends on the setup where you are doing.